So I'm Dr. Moni Singh from Richardson Face Hospital. I am the dermatologist here. So we are doing all kinds of procedures. Today we had a patient who had a history of hair loss from many years. So for him, what we can do? We can do PRP, we can do GFC, and if required, we can go for hair transplant also. Today we did PRP. So I'm going to tell you about PRP. What is PRP? PRP is nothing but platelet-rich plasma. What is plasma? Blood has two constituents. First is cellular material and the second one is plasma. Plasma is liquid part of the blood. So plasma is rich in growth factors like VEGF, vascular endothelial growth factor, EGF, endothelial growth factors, other type of growth factors. It has like a very strong growth factor concentrate in addition to other materials which are required for cellular growth. So plasma of this kind is used to revive stem cells. In hair we have hair stem cells which are revived due to giving this plasma content regularly on interval of 21 to 45 days depending from one patient to another patient. So what we do, what is the procedure? We will take your blood, 5 to 10 ml of that blood, seeing how much plasma you require, and then we'll centrifuge it in a centrifugation machine in our lab, and then we'll take the platelet concentrate, the plasma concentrate which is upper, and put it in insulin syringes. Insulin syringes are thinnest possible syringes to decrease the pain in this process, and then we'll inject it over the scalp. To make the patient comfortable, we'll also use numbing cream sometimes if the patient is not comfortable. So this is the process, and then the process is repeated 21 to 45 days depending on the patient's need. This is the process of platelet-rich plasma. This in medical science it is called as liquid gold these days because it is used for multitude of purposes including hair and skin rejuvenation, joint arthritis, even in the eye, and wound healing. Wherever there is trauma, platelet-rich plasma is used to speed up the process of wound healing. The same principle applies to the hair also. In addition to doing the platelet-rich plasma therapy on hair, we do it for face also, and if required, some scar therapy also. It can be combined with microneedling, and it can be followed up with CO2 lasers or any other treatment you might require like threads. Thank you.